everyone. It's Terrence Branley with the GRR IT Podcast. And today I'm lucky to have Andy Flynn with me, who is the president and CEO of HPG. Andy, what does HPG stand for?
Healthcare Performance Group. That's a shout out to Randy, my CFO. He's proud of the full name. So I want to make sure we get that in there. And technically I'm co-CEO. Matt Terstrup is the other half of the CEO position. So
Got it. Well, I'm surprised that your CFO is the one that's a stickler about the whole name. Usually it's us marketing folks, but maybe it's the marketing folks that shorten it. So, but I know you guys are in healthcare, with integrating, optimizing EHR technology, which I believe is electronic health records, if that's correct, for hospitals and health systems.
correct. Yep.
Cool. Well, thanks for joining me. Let's kind of dive in. Why don't you tell me a little bit about your background and kind of your journey.
I kind of have an odd background. I am a medical technologist by training. I got my degree from Missouri State. It was a dual program with a local hospital, Lester E. Cox Medical Center. So I graduated in 1993 with a degree in medical technology, board certified by the American Society of Clinical Pathology. So, shout out to all the med techs out there that are working in healthcare. We're behind the scenes kind of people, so they need some recognition. The med techs do. They do a lot of good work. So, but I started out as a med tech. I was working in a kind of a strange area of the lab, toxicology. Most labs don't have a toxicology lab. We had our own laboratory information system. It ran on SCO Unix, and it had an Oracle database. And then we had instruments in there, quadri. I can't even talk.
Well, I'm not going to be able to say it. Don't look at me.
They were mass specs, and one of them ran on Pascal, one of them ran on HP Unix. So I got pretty familiar with Unix and those varieties of operating systems. And then in 1996, I believe, the hospital was looking at Y2K coming up. They were kind of panicked because they were on a mainframe and, of course, 2-digit year versus 4-digit year. So they started looking at different platforms, and they showed me one platform, and it had a mumps database. And I'm like, where are you going to find a mumps database administrator? That's going to be really hard. And then they showed me one that was called Cerner at the time. It had AIX for the operating system. It had an Oracle database. And I was like, oh, that's the one you want. So that started my journey into the EHR side of the world. So we implemented that. We went live in 1997. The largest single node customer that they had at the time. And if anybody is familiar with Cerner, which is now called Oracle Health, we went live on Rev 7.8. So
wow,
the Rev numbers are much longer now. I'll tell you that much. So I went into consulting in 2001, where I met Matt Terstrup. I mentioned earlier that he's the other half of the CEO position. I also met Randy Bollinger, my CFO. And then there was another individual named Randy Passman that I met. And in 2002, the four of us formed Healthcare Performance Group. And so we've been running that since late 2002, so 23 plus years.
So obviously in healthcare systems, and healthcare in itself has its own unique set of challenges, right? I mean, unlike any other, business that has IT software, IT related issues, the challenges, both from a patient standpoint to a payer to a payee, right? The insurance companies are involved. Maybe talk about some of the problems that you guys are helping those folks, your clients, what problems, you're helping them solve? What are their pains? What are they trying to accomplish?
They vary across the board. Of course, when we first started, not a lot of standardization had begun. So, I, as a consultant working on 17 different EHR implementations and focused on the lab side, because that was what I was doing back then, I wouldn't see a CBC built the same way from one lab to the next, because in this state, they interpreted the regulations a different way than they did in another state. And so, there wasn't a lot of standardization back then. The industry itself has kind of forced a lot of standardization in there. It has a long way to go. But, when we first got started, people would purchase an EHR and they'd get so far along in the implementation, they'd realize that, the vendor supplied resources knew what the vendor taught them, but they didn't understand maybe what was going on there. And their folks didn't fully understand the application. So they needed I always call myself an interpreter, right? So they needed a consultant to come in and be that independent voice for the customer to represent, this is what they're saying, this is what they need in your system, and translate that into a language that the system people understood. And so we just would go and basically help them implement an EHR system and make sure it worked for them, fit their workflows. So it's just like a really kind of unique position to be in, where you understand the technology and you understand the workflows and the terminology that they use in the hospital, whether that be in the pharmacy or the lab or radiology, or if you're on the clinical side, doing clinical documentation as a nurse or a physician, order entry, those kind of things. It's a lot to learn. Most of the vendors will hire kids out of, university, smart kids. They bring them up to speed, but they only know what they're taught there. So they haven't been in an actual clinical workflow. They haven't seen how nurses do what they do or how doctors do what they do.
Is that what makes it kind of unique, right? I mean, it does, right? But like it's different from manufacturing or operations or anything in a typical business environment. I mean, there's always kind of, input, output, even if you're talking about a service related business, but healthcare has this unique, aspects of it, and that it's patient centric, right? You have insurance companies that are involved. So different people that are in part of the revenue stream. You have the folks that are the nurses and the doctors and the pharmacies, right? Like there's just so many different pieces in there, and it is such just its own animal.
Different instrumentation, different devices that are used on patients. All of those have to be integrated into the EHR to send that data in. So yeah.
Let me ask this. So let's take a step back to the EHR, just so we kind of understand, right? To me, I think of it, the dumb guy thinks, okay, that's like a CRM, but for healthcare. And is that a decent?
It's a very simplified view of it, but you think of a CRM and you think of the functions in there. At the time they started, and this was, back in 1997, there was 1,200 different applications that were in that EHR suite. And that was I think it was about 2010 when meaningful use hit, and we had to start focusing on physician order entry and all of this stuff.
I want to know, like, what other types. So we talk about EHR, right? It kind of be in a CRM, and it's integrated into systems. Talk a little bit about the different players involved, from the payers, the payees, the medical systems themselves, and all the different applications. And you talk about, as technology evolves, you start to get more and more technology that comes into the healthcare system, right? Both from devices standpoint as well as capabilities. How has that been for healthcare systems, your clients? How has that been for trying to manage that process? Like, where are they at right now? Let's call it even in that life cycle, because as a business, they're always trying to be at the forefront of technology and using it to drive more profit. That's not always the driving factor with healthcare, right? It's patient delivery and healthcare, and the outcomes. They want to make profit too, right? But like, there's just different factors that come in there. But maybe talk us through some of the different challenges that some of those your clients are working through and coming to you for help for.
Just undergoing the process to select an EHR is a huge challenge, and there are companies out there that help with that selection process. Once they've decided on one, then implementing it is a gargantuan task. I mean, it takes a small army of people. They have to be trained on those applications. They have to be trained how to implement it. And then they really need to understand the workflows. So different vendors have tried different approaches. There's the waterfall approach to an implementation, where you go through a current state, a future state, gap analysis, and then you try to bridge that gap as you're moving from one system to another system, because they don't all do things the same way. And my favorite thing to say is the system I had before is always my favorite system. Right? Nobody likes the new system. They always say, well, the old system used to do it this way.
We're creatures of habit, right? Like, we like what we know, and having to learn a new system is a challenge, right? Especially when you
overcoming that workflow and that way of doing things is a huge challenge, because they buy a new system which has capabilities that can move them forward, but then you've got to get the people to adopt the new workflow, and they always want to revert back to an old workflow. So that's a huge challenge, and it takes buy-in at the top leadership level of a healthcare organization to make sure that those new workflows get adopted. So if you don't have that buy-in, that can cause problems with your
Yeah, and
implementation.
I think that goes without saying, even outside of healthcare, right? I mean, even in any large organization, if you don't buy in.
But the scope of it is just, it's almost unimaginable. It's like eating an elephant. You just have to start one bite at a time, and you got to start somewhere, because it can be overwhelming when you see the amount of work that has to be done.
Let's talk about some of the success stories, right? I mean, obviously, you've been in this industry for a long time, and even let's just talk recently about some of the folks that, some of your clients, again, whether they're healthcare systems, medical facilities that maybe some of the different, maybe give me an example of kind of a larger one versus a, more of a mid-sized one in terms of how you've been able to come in, help them with their challenges and trying to get them where they're trying to go.
I give you like one real specific one I'm kind of proud of. I was working with a pharmacy director at one of our customer sites, and he came because he was concerned, as patients are moving through the hospital, that your kidney function can dictate what level and what amount of drug you can handle. Like if your kidneys are failing, they don't want to load you up with some really tough antibiotics that are going to basically kill your kidneys, right? So he wanted to know, he had 3 different levels on the glomerular filtration rate, which is a lab test, when somebody crossed from zone 1 to zone 2 to zone 3. He didn't care where they were. He just wanted to know when they moved from one zone to the next or back and forth, because that would affect how they dosed their patients. And so he and I worked together on writing what we call a rule. This was in the Oracle Health system, so it was a discern rule. And nobody wants to see this data. So I was trying to write the rule, write the data to the database without it showing up in the flow sheet, where the doctors would be like, "What is this? Nobody cares about this, right?" So
Who put this in here?
we got all that done. We moved it in, and we tested it. We moved it into the production. And that week before I left to go home, he called me and he said, the rule's working. He said it fired, and he went up to visit the patient, and the patient was seated on their bed with their bags packed, waiting for a transporter to come take them to let them go home. And he said, "Well, I'm sorry to tell you, you're not going home," because their kidney function had degraded enough to where it was a concern. So that was a great problem to solve. There's millions of problems like that, and there's an infinite number of solutions. That was one I was proud to have worked on. It was really all the pharmacist's idea. He's really smart, great guy. Friends with him to this day. He's not still at that customer side. He's moved on, but really good.
That's amazing. So, what are some of the executives and some of the executive and director levels of these healthcare systems, or facilities? What are they wrestling with right now in terms of what are their biggest challenges in terms of the
Depending on the size of the organization, I think the smaller organizations probably struggle with finding IT talent that can support the EHR. That's a struggle that we've seen. Even in larger institutions, it can be hard. You may have it fully covered, and then somebody has to go on maternity or paternity leave, and they're gone, so you need temporary coverage for something. At HPG, we have solutions for that. We call it support center. So instead of like the traditional staff augmentation, where you sign a contract for a specific consultant for 40 hours a week, for however long you need them, with the support center, you basically sign a contract that if you have a need in that area, then we'll provide a resource for that, and then that you just pay for the time that resource works. You don't pay like a 40-hour work week. You only pay, like, you need 6 hours, you pay for 6 hours.
Do you see that as a need moving forward for systems? I mean, again, like there's not an readily available pool of talent around, right? But
That's a service line that we started probably close to 6-7 years ago, and it's continually grown, and it's taken on more and more responsibilities. So now you have a system that maybe has EHRA, and they want to move to EHRB. So they need somebody to maintain their current EHR while they take all of their IT people over to the new system, get them trained on how to implement that. And then for the next year, they're implementing that new system. In the meantime, our guys are back there supporting the old system. We call it lights on. You don't want to be making a whole lot of changes in the old system, because then you've got to echo those changes forward into the new system. And so it's best to keep it static as possible. So that's a service that we provide. We call that legacy support for people that are moving from one EHR to another EHR. And that grew out of that whole support center idea of having a staff of people that can handle a wide range of, you've got lab, radiology, pharmacy. I mean, I can go through all of these, anatomic pathology. You've got a whole range of things that people have to know, specific workflows, specific tools, and how to implement that and do it correctly.
It does, and it's pretty specialized. It would seem like that would be something that that you'd, instead of trying to bring someone in and to train them on those multiple different areas of the healthcare system and their unique workflows, that would make more sense just to come to you and say, "Hey, Andy, can you guys give us someone that
Right.
that we can plug in and understands?" Because the workflows, I would imagine, are not going to vary tremendously in terms of, the role, whether it's pharmacy or,
Not usually, but they can. You never know. They can.
anytime you say that, right? Anytime you say usually or never, right? It's like,
Nothing's ever guaranteed to be the
yeah.
same. That's for sure.
Well, you mentioned kind of that part of the business is something that you've grown out. And as we're talking about, growth, what are the challenges that you guys face in terms of growing your firm, right? I mean, as entrepreneurs, as business, executives and owners, there's never a lack of, so that's almost a given, right? There's always challenges, period. But what are the challenges that facing, you guys when you're trying to grow, HPG?
I think anybody that's in our industry would recognize the effects that COVID had on our industry. Uh, they're still in effect now. Like we used to travel Monday through Thursday. Our staff augmentation, which is bread and butter, they were on site doing implementations Monday through Thursday. COVID hit. Not even the customers were going to the office. A lot of customers sold their office space. I mean, so it changed. It made a huge change to how our work gets done. So we still travel for go lives and other events like that, but typically what we do is done remotely now. So getting that, face to face time and being able to develop the trust of a customer that this is a talented resource, they know what they're doing. You're more limited because you're virtual now, rather than being there and being in front of them every day. That's a challenge for us. It's a challenge for our sales folks. I mean, during COVID, they couldn't go visit their customer. Can you imagine trying to sell services and not be able to visit your customer? So that was a challenge. That's changed as well. So, I think that's one of the biggest challenges is just the industry changes that have happened over the last very short time span. And some of those have been big, and they were caused by a huge event, COVID. So as a management team, we get together, we look at the challenges, and we come up with our response to it. So that's what we'll continue to
What
do.
has been your response to it? I mean, again, that's a big change, right? You talk about Salesforce, and again, and at one point in my career, I worked for a medical device company and called on, hospitals and medical facilities and did the, show up and, have, bagels and coffee and getting feedback on, product and understanding that. But, again, I can't even imagine that was pre-COVID. That was pre a lot of technology. I can't even imagine what that would be like today. But I mean, what's been your, reaction, or how have you guys adjusted to it?
We were already considering new services, and I think that's our biggest response has been to come up with services that are specific to our customer needs. But right when COVID hit, we had decided to move from being exclusively focused on Oracle, which was previously called Cerner, to then expanding to look at Epic as well. Horrible, horrible time to start a new EHR because COVID hit. We couldn't go visit any customer. We couldn't do anything, So that's been a long road for us to break into that market space. And then recently we have joined Meditech's Alliance program. We're pretty proud of that. In 23 years, this is the first time an EHR vendor has included us as part of their solution. The rest of the time, we've just, had a arm's length kind of relationship, and we were viewed as competition, even though we're going in there and trying to make their applications work better for the customer. They still viewed us as competition because they had their own consulting services that they sold. So, that 23 years was a long road to haul. So kind of excited about that. But our response has been looking at what the needs of the customers are and developing specific solutions around those needs.
Would you describe that almost like a channel partnership?
With Meditech, it's their alliance partnership. So it gives us access to, we can send folks in to get certified on their applications. We can participate in their events. And we'll work with them on solutions for their customers. So I guess you could kind of consider it like a channel partner.
Yeah, I mean, again, I think anytime you look at someone that, like, to your point, that they may have viewed you as a competitor because they offer consulting services, but then you and again, I don't know if is it a formal alliance group? Like, maybe if you can explain the structure.
Yeah, it's a formal alliance group. You have to apply and you have to be selected. We actually went down and interviewed with them at their headquarters, which is just outside of, or in Boston. So very beautiful campus that they had there. I was pretty impressed.
What are some of the trends that you're seeing? Obviously, in IT overall, AI and learning models, large learning models, and generative AI kind of dominates the conversations these days. And I don't know if that is also the case with within the healthcare sector in terms of IT. But what are you seeing both from a trend standpoint and whether that AI conversation is even happening, within the organizations, whether it be at the executive level or other?
AI is the big buzzword in EHRs. It's in its infancy. I think that several the vendors that we work with, all three of them have some level of AI incorporated into their EHR at this point. I think with Oracle, they've got primary care physicians. They've got an AI solution for primary care. I think Epic's is similar to that, and I think Meditech is also similar to that, where they're trying to assist the primary care physician by basically the AI is listening while they're talking to the patient. And it's smart enough to know if, like, we start talking about football, that this is not going in the patient's record, right? And so afterwards, when the doctor walks out, the AI will have suggested, do you want to order these lab tests, or do you want to do this to schedule follow? So it's making suggestions to try to speed along the primary care physicians. And I think for primary care physicians, one of the most important things is how many patients can I see in a day? And if that EHR is slowing me down to where I can only see 12 when I need to be seeing 20, that's a problem. So I've got to change my workflow so I can see more patients.
Do you see that as the biggest impact that it can have, or what are some of the other areas that you potentially see AI or large learning models having on?
I think AI is probably going to get incorporated into dashboards for the C-suite. So the CMIO might have a dashboard and the CNO might have a dashboard, CEO might have his own, CFO might have their own, which is similar to the current dashboards where they got KPIs in there, but then the AI will be actively pulling that data for them in real time. I see that coming along pretty quickly. You know, your imagination is where AI can go in healthcare. And so, like I said, it's in infancy now. I think the other kind of buzzword right now in healthcare is this, or the other challenge that we're all facing is the remote work, which I mentioned earlier. So those two things are kind of big in healthcare.
How right so now. The remote work part? Because again, one of the things I wanted to ask about too is, right, technology has also allowed, for those primary care physicians to even do remote, seeing patients remotely, right? But maybe what you're referring to is probably different. But that's one of the first things that came to my mind, though.
Well, it's not just the consultants that are remote. I think most of the IT staffs at the hospitals come into the office maybe a certain number of days a week, and the rest of the time they're working remote, which is unique post-COVID versus pre-COVID. So I think they're dealing with remote work and how to manage that and make sure that they're getting their money's worth for what they're paying for, especially if it's a consultant that they're paying high dollar for. So you got to manage that remote work as well.
What are the executives talking about right now, whether it's specific to AI or remote work, or what are the initiatives that they're looking at? Because they have a tendency to look out a little bit further than maybe the rest of the folks in the organization that are looking at their day to
I
day
usually deal with the CIO, so I don't get to deal much with the CEOs or the CFOs. But with the CIOs, they're constantly looking at the roadmap for their EHR, what's coming down the pipe there. They're also looking at, they have more than just the EHR to worry about. They've got all kinds of IT infrastructure and, printers, devices, all this stuff. So how do we keep track of this? How do we update it? Um, what kind of hardware is needed to run their EHR. EHRs are changing, so some of them are trying to move to a cloud platform. That's a big
Hmm.
thing for the CIOs to be considering if they're not already in the cloud, how they're going to get to the cloud. If they're going to get to the cloud, what makes most sense for their organization.
How do the different medical devices, right? Because I think that's something, at least in my head, thinking different. I'm just trying to think of differences from healthcare and medical systems to a manufacturing operation. Like the different medical device manufacturers, right? I mean, there's just so many different products that come in that now are probably these products are smarter than they were, 10, 15 years ago when I was in the industry, or 20 years ago. How are they managing that whole process in terms of integrating it into their EHR and their systems?
Yep, that can be difficult. Some of those integrations require FDA approval. So, depending on the device, if you're in the lab, a lot of the interfaces that are done through the lab, they require FDA approval. So, you don't see those changing quickly. So, technology is what I'm saying is technology and those types of things tend to lead the integration portion because you have to wait for that device to be approved to be integrated, if you know what I mean. So while you and I may have, very simple devices that connect quickly to our phones now through Bluetooth technology and things like that, it's not like that in the EHR world. It's slower to get that kind of level of.
That's a challenge, isn't it? I mean, that's a significant challenge.
It is a challenge, and then you need a platform to manage all those integrations. When we first started, like the medical devices in the lab were managed in one spot, and the medical devices in the rest of the hospital may be managed in another spot. So now they've combined all those to be managed in one system, which makes it easier for the IT folks. They don't have to learn multiple systems to manage all these devices. But that's been a long time coming. So it's a much needed improvement, and I'm glad they have it
Yeah.
now. So.
All right, let's get off the business stuff. What do you enjoy doing outside of your work? What are some of the things? I mean, I know we talked offline. We talked about,
Outside of work,
yeah.
if you can see my desk, I mean, there's all kinds of projects laying on my desk. I prefer the term nerd over geek. So I've got lots of little projects going on here. But I usually focus on some type of IT thing. So I don't know, make it like I have a 1963 Lincoln and I took the door handles off. So I put poppers on there and MIT has a little application that you can create your own mobile app using their technology. I don't know how to code, so you don't need coding knowledge to do this. And then I used a device that's Bluetooth capable, and I can connect that to the car, and then I can say I want to open the driver's door. I push a button on my phone, and it opens the
No
door. That's the
kidding.
kind of weird stuff that I like to do on the side.
Wait a second. Now you're gonna have to explain. Now you got me. I at one point I had a '67 Mustang, and I always was looking at it. It's like, man, it's so hard to believe how much further we've come along with it. How are you doing that with that? So
So this is the device I'm using. These are relays, and then I use an Arduino. And so basically, the MIT app communicates with the Arduino. The Arduino has a Bluetooth device, and I basically send it a number 1, 2, 3, 4, 5, 6. Based on that number, it tells one of these relays to open. It's that simple. And that relay connects. This connects to the car, and it pops the door.
what else do
So
you have it connected to within the car?
I I could connect it to the windows, but I think I'm just going to leave it at the doors for now. I don't want to get too I don't want to get too fancy. The doors in the trunk. The trunk has a popper on it too.
Especially, it's funny because I was just telling someone back in the day when I had my '67 Mustangs that uh, when you put your keys accidentally in the trunk and shut the trunk, You were in trouble. You were calling a locksmith, right? It wasn't like today, like, hey, we'll just go inside to the front driver's seat and pull the little lever that will then remotely open the hood.
So, yeah, that's an example of one of my many projects that I'm working on.
Okay, well, let's do this. Can you walk us through? Let's go back to the business side. Can you walk us through what it looks like for a new client that comes to you guys? Whether they have their own challenge, pain points, maybe trying to integrate 100.
It usually starts in one way or another with an introduction to HPG. Maybe that's at an event, a user group meeting. Maybe we did a cold call and we met that way. But it starts with an introduction, and then we go over our methodology. We listen to what their needs are, and then we craft an offering specific to their need. Does that make sense? So that's a lot of times sales cycles for our type of business can be very short, depending on what type of sale it is. If it's staff augmentation, a customer has a specific need. I need a pharmacy resource, or I need a clinical documentation resource, and I need them for 3 months. That's a 2-week sales cycle right there. We give them a profile, they do interviews, they select a candidate, paperwork gets signed, and it's a done deal. Some of the other service lines, they're support center might be a long-term engagement. Maybe that's a 3-year engagement. That's a longer sales cycle. They've got to go through and make sure that this solution is going to be what they need, and that we've got it staffed right for them, those kind of things. So, but like I said, usually it's an introduction. At one of these meetings, we learn about their needs. We craft a solution specific to their need.
You mentioned that staff aug. I don't know if that's probably a shorter cycle for you. How long are some of the larger engagements or projects if you're working on a pretty extensive, whether maybe something where they're moving from on-prem to the cloud?
We've got some of our staff augmentations are 20 plus resources working on rolling out. Say you've got a facility that has a specific EHR, and they buy another facility, or maybe they buy 3 facilities. Well, you don't want 3 different EHRs, so now you want to roll out your EHR build to these other facilities and kind of pull all of that in to where you're managing it with one group in one location, instead of having to manage 4 different EHRs with 4 different groups. So those are large projects. They typically 12 months or longer, and they require a lot of resources with specific skill sets.
Well, and healthcare brings its own unique challenges, and if executives out there watching, if they want to learn more about HPG, if they want to follow you on social media, or get in touch, what are some of the best ways for them to do so?
Of course, our website, hpgresources.com, is a great way to get a hold of us. We're on Twitter and LinkedIn. So any of those, if you find us, follow us on Twitter, follow us on LinkedIn.
I think Elon would be upset because I think he's changed it to X now, but I still call it the same. I call it Twitter, and I still call.
I don't want to upset Elon. I apologize, Elon X. Okay.
We'll make sure and put all the links down there in the show notes, both your site and your LinkedIn profile, and maybe we'll just mess around and put twitter.com and your handle there, rather than we'll really make Elon mad. So
let's not get Elon mad. I've got a Tesla. I don't want him mad at me.
So do I. That's what I said. I got a Tesla.
No more updates for you.
I need a pass. Can I get a pass? Right. Well, Andy, it's been great talking to you today, and I appreciate you sharing your insight.
Well, it's been great talking to you. This is the first for me. I've enjoyed it.
You got to keep doing them. Keep doing them. You're good at it.
I think you're good at it. That's why.
I just do a lot of it. It's just like riding a bike. You do it enough, and you're just going to become okay at it. That's where I'm at.
I want to be okay someday.
Well, you're okay in my book.